Welcome back to Dog Hobby 2020. Please participate in the polls that appear on top right of your screen. Today's topic is cardiopulmonary resuscitation. Here we have two doctors shopping in a mall. They noticed people crowding at one place and found out that someone became unconscious and he remained like that for 2 minutes. Doctor ensured that scene is safe. The victim is unresponsive. Spontaneous respiratory efforts and carotid pulse are absent. One of the bystanders volunteered to call medical emergency service. Chest compressions were given by placing heel of one hand on sternum at middle of chest with other interlacing the first hand. Doctor kneeled using her entire body weight as leverage, pushed hard with elbow straight, displacing the chest wall 5 cm down and allowing complete recoil between compressions. Meanwhile, speaker is on and doctor told that the victim is in cardiac arrest and they have started basic cardiac life support. He advised medical team to get external defibrillator. Doctor tilted head slightly backward, opened mouth and saw clear airway. With 30 compressions done, he breathed 2 times forcefully into victim's mouth with nostrils closed and looked for the elevation of chest. 5 such cycles are given. Carotid pulse did not appear and CPR is continued. After some time, emergency medical team took over. Let us look into social message. If you see someone collapse while walking and is still not responding to your command, immediately take him to the safe place from risky areas like traffic road where incident took place. This shifting should happen only if you are capable to do. Don't put yourself in risk to save someone like entering a burning house. Whether you bring the victim to safety or not, call emergency medical service. If you can bring him to safety, give some hard taps on the shoulder and shout at him asking if he is okay. Once again I am telling, call emergency medical service. India has got national emergency number 112, ambulance 102 and medical service helpline 108. These emergency numbers are to be dialed only in case of emergency. But if you do it to test or for a prank, you committed a criminal offense and you should eventually answer to law. Now that you called yourself or assured someone called for help from medical service, check the carotid pulse by placing your index and middle finger below jaw and beside windpipe of victim. Counting pulse of a person might be difficult if you are doing it for the first time. So let us train ourselves every day because checking pulse regularly increases efficiency of your exercise. First rule, 1 carotid pulse at a time. Second rule, be gentle. You can do it to your family, relatives and friends to see if it is in normal range of 60 to 100. Mine is 74 while making this slide. Shall we see how pulse helps in our daily exercise? Calculate with me on a piece of paper. Subtract your age in years from 220. My age is 22, so the result is 198. Now multiply it with 0.65 and 0.85 to get two values. Here I got 129 and 169. Now what I do is exercise as usual and immediately after exercise check my carotid pulse for 1 minute. If my pulse rate falls anywhere between these values, I am doing enough to burn fat and improving health of my heart. One small warning before we go back to our collapse victim is take guidance from your doctor if you are planning to exercise after a long time or have heart, lung or balance problem. Now if you can feel the pulse of the victim, turn him completely and make him lie on left side and check for carotid pulse every 2 minutes. If you did not get pulse for 10 seconds or pulse stopped during your 2 minutes monitoring for 10 seconds, then it is time to do CPR. If you are not trained in CPR or not confident enough to perform CPR, give chest compressions only. Don't feel ashamed if you can't give rescue breaths because we don't expect you to. You are a hero already no matter whatever be the outcome because you are doing something to save a life while others are staring to quench their curiosity. Push hard and fast leaning over the patient with your both fists interlaced on one another on middle of chest with your elbow straight and allow complete recoil of chest between compressions. Check pulse every 2 minutes. If pulse appears, turn him to left side and monitor pulse every 2 minutes. 100 to 120 compressions per minute are expected. Why don't you try it on your pillow and see? You will fatigue soon. Same goes when you are giving CPR to a person. So ask someone to replace you when you fatigue. or for every 2 minutes. If you are alone and cannot continue any further, just stop and wait for medical team to arrive, because when you fatigue, quality of your chest compression is low and even if you perform, it is useless. Continue compressions till medical team arrives if you can or has enough manpower. Do not feel guilty if you couldn't save a life, because you are not the one who gave it in the first place. Do not forget to celebrate if you saved a life, because God owes you one for saving part of His creation. Comment, share, like and subscribe for future videos. Thank you.